Japan has a well-established collaboration network among its health and medical care systems. This is one of the major factors which contributes to maintaining high standards in health and medical services in Japan. How do Japanese health and medical care systems work? In this video, we will provide an outline of the health and medical care services within the major functions of each institution in Japan. First, let us take a look at the Japanese administrative system. It consists of 3 levels, namely the national, prefectural, and municipal governments. Prefectures and municipalities have autonomous functions and are often referred to as local governments. Health services related to the health management of community residents, such as prevention and health promotion, are provided by public health centers and municipal health centers under the responsibility of local governments, such as prefectures and municipalities. Medical services are not provided in both the public health centers and municipal health centers. Instead, hospitals and clinics provide medical care services to cure diseases. Now, let us look at the health administration system. The Ministry of Health, Labor and Welfare is responsible for the administrative system at the national level. The main role of the ministry is to create policies and programs for the establishment and maintenance of various systems for health, medical, and welfare services. Meanwhile, the main role of the local government is to plan and bring effective health services to people in the community based on national policies and programs. Now, let us take a closer look at local governments. In Japan, there are 47 prefectures and approximately 1,700 municipalities. Each prefectural or municipal government plans and implements its own health and medical programs based on the national policies and programs designated by the Ministry of Health, Labor, and Welfare. Each prefecture is divided into several health districts. Public health centers are established in each health district. One health district consists of several municipalities, and a public health center is responsible for those municipalities. Municipal health centers provide direct services to community residents with the technical support of public health centers. Now let's take the case of a family to see what kind of health and medical services are available in Japan. Here are Mr. and Mrs. Tanaka. The husband, Mr. Akio Tanaka, is 35 years old, and his wife, Hanako, is 30 years old. Akio works for JICA as a program officer, and Hanako works for a private computer company as a system engineer. Akio and Hanako have been married for 3 years and want to have a baby sooner or later. Akio looks healthy, but he has had something to worry about recently. Every time he gets up in the morning, he feels pain in his stomach. He has had the same symptoms since last month. He decided to see the doctor he usually visits. This doctor practices in a clinic close to Akio's home, specializing in internal medicine and pediatrics. In Japan, people can choose to go to any clinic or hospital. This time, he chose a clinic close to his home. He has undergone some examinations, and today he is consulting the doctor for the results. Here is an explanation of the Japanese health system. In Japan, Public and municipal health centers are responsible for providing preventive services, such as health promotion and health checkups, whereas medical institutions provide medical care. Under the Japanese Medical Care Act, when a new medical institution is opened, permission must be given by the head of the prefectural government or the mayors of larger cities. Once opened, the medical institution is placed under the control of local governments with public health centers, such as prefectures and larger cities. Institutions controlled under the Medical Services Act include hospitals, clinics, and maternity homes. Generally, adults like Akio can choose either a hospital or a clinic to have a medical consultation. He can also choose either public or private institutions. Public and municipal health centers in Japan do not provide medical services, so these are not available options at this time. As such, Akio chose a private clinic close to his house. Let us now go back to how Akio is doing.
長いことね、症状が続いていることで、一応胃カメラの検査をさせていただきましたけども、少し胃のあれはありましたけども、それほど大きな改良があるというわけでもありませんし、そうですね、少しお酒とかは控えてもらった方がいいかもしれませんけども、胃のあれがちょっと続くようですので、簡単な胃の薬を出そうかなというふうに思っております。どうですかね、何か心配なことが他にありますか？
Akio has finished his consultation with the doctor.
田中さん、それではですね、今日こちらの方がお薬処方箋になりますね。で、こちらが代金になります。2000円ぴったりになります。
He received a prescription from the doctor and has to pay the consultation fee. He has to pay 30% of the total amount of the fee. 70% of it is covered by health insurance. In Japan, everyone is obliged to have some kind of health insurance. Furthermore, each medical treatment and the prescribed drugs have a fixed price. The fee for treatment is the same in whichever clinic or hospital you go to. There is no difference between public and private institutions.
ちょっとお預かりしますね。
ありがとうございます。
大臣どうぞ。
Akio goes to a pharmacy near the clinic. He submitted the prescription to the pharmacist and received the medicine. Here again, 70% of the total amount of fees is covered by health insurance. Akio's pain is nothing serious, but he might need to go to the clinic several more times. Now, let's turn to Akio's wife, Hanako, who works for a private computer company. One day, she felt she might be pregnant, so she bought a pregnancy test kit at a pharmacy and tried it at home. The result was positive. She shared the news with her husband. What a wonderful surprise for Akio! The next day, she went to a private obstetrics gynecology clinic to consult a doctor. In Japan, pregnant women go to a hospital or clinic to confirm their pregnancy. After confirming the pregnancy, they receive prenatal care at a hospital, clinic, or maternity home until they deliver the baby. People can choose a place for prenatal care and delivery, with their options including a hospital, clinic, or maternity home. The doctor examined her and confirmed that she was pregnant and was already in the 8th week. The staff told Hanako to come to the clinic every month for a regular prenatal checkup. In addition, they also advised her to report her pregnancy to the maternal and child health office of her municipality of residence and to claim her maternal child health handbook with medical vouchers for health checks. This is the Municipal Health Center in Municipality A, where the Tanaka family lives. The following week, Hanako visited the Maternal and Child Health Office at the Municipal Health Center for her pregnancy registration. Henceforth, she is able to receive the health services provided by Municipality A. A public health nurse interviews her and gives her a maternity package with an explanation. The package includes the MCH handbook, medical vouchers with which she and her baby can receive free regular prenatal checkups, and a booklet containing health tips on pregnancy and baby care. This is the Public Health Center in Prefecture X that is responsible for Municipality A, where Hanako is living. Public health centers have a variety of roles and activities. Various programs are covered by a public health center, such as infectious disease control, food hygiene, HIV/AIDS, maternal and child health, and mental health. One of its roles is planning, implementation, and evaluation of health programs in responsible health districts. Another of its roles is to support the Municipal Health Center for planning and evaluation of health programs in a municipality. A public health center has all kinds of health professionals, including medical doctors, veterinarians, pharmacists, public health nurses, dietitians, and laboratory technicians. Meanwhile, municipal health centers are established under the municipal government. They provide comprehensive health services, such as health promotion, health checkups, and vaccinations to community residents. Now let's look at how public and municipal health centers in Japan provide their services using Hanako's case as an example. As scheduled, Hanako went to see an obstetrician for a regular prenatal checkup using a voucher. The doctor happened to find some abnormality with her. In this kind of case, the doctor decides whether to treat her or to refer her to an appropriate hospital. Afterwards, her physical and psychological condition should be reported to the Maternal and Child Health Office at Municipality A, where Hanako lives. The Municipal Health Center will further consult a public health center in charge of Prefecture X if necessary. The Municipal Health Center will provide preventive measures to Hanako, such as the arrangement of home visits by a public health nurse. Such services are provided in collaboration with local municipal and prefectural governments and hospitals in her place of residence. This follow-up continues until Hanako holds her baby in her arms. It's already been a few months since Hanako gave birth safely. After Hanako gives birth, her baby will undergo some health checkups and vaccinations at a municipal health center or a clinic in her community. The baby will grow up being very involved in the Japanese health and medical care systems. See you again in the next story. Goodbye and sayonara.